Good day, my name is Stephanie Claire Escar from BSN 12C, and today I'm going to perform open gloving. So first is we're going to perform a thorough hand washing. We're going to follow the steps in performing hand washing or hand hygiene so that we could decrease the bacterial count on hands and we could prevent contamination of sterile equipments. Okay, so now that we're done on performing the hand washing or the hand hygiene, we're going to prepare the sterile glove to ensure the correct size, and we're going to inspect if there is any tear and any stains in the packaging to ensure that we have the proper fit and the gloves integrity and to maintain its sterility and protect against the contamination. Okay, so now that we have already inspected and prepared the sterile gloves, we're going to open the package. So the outer wrapper of the glove by carefully separating and peeling it apart in the sides so that we could prevent contamination of the inner sterile contents. Okay, so next, we're going to grasp the inner package and lay it on a clean or flat surface in the waist area to maintain its sterility by placing the gloves on a clean and appropriate surface. Now we're going to identify which is the right and the left gloves, since we're going to do the dominant hand first, and that is to ensure the correct orientation and easier gloving by starting with the dominant hand, which is my right hand. Okay, so now the thumb of my with the thumb and two fingers of my non-dominant hand, I will hold the cuff to the dominant glove, and I will only touch the inside to avoid contamination by touching the outer cuff. So now I'm going to carefully pull the glove on my dominant hand, keeping the cuff in place, and I'm going to align the fingers and my thumb properly to ensure that we have the proper fit while maintaining the glove sterility. So now I'm going to carefully pull the second gloves into my non-dominant hand, avoiding contact with the exposed skin and keeping dominant thumb abducted, which maintains sterility and prevent skin contact. So now I will carefully put it in a, I will arrange it since it is not perfectly done. Okay, so now after donning my second glove, I'm going to interlock my gloved fingers, and I will hold the hands above my waist away from my body so that until the procedure begins. So it is to preserve the sterility by keeping the glove in a clean, safe position. Okay, now after we already have the gloves, now we're going to dispose it. So first is we're going to grasp the inside of one cup with the other gloved hand. We're going to avoid the wrist, and we're going to pull halfway to the palm, slide the thumb of the half gloved hand under the cuff of the other glove, and that is to prevent skin contact with the contaminated glove surface during the removal. Okay, now that I have already pulled the glove, I'm going to turn it inside out, and we're going to discard it in a receptacle which contains contaminants and also reduces the risk of exposure. Now, using my bare hands, I'm going to tuck the inside of the remaining cuff, and I'm going to peel it inside out, and I will discard it properly, okay, to avoid touching the contaminated surface, ensuring the safe glove removal. Okay, so now I'm going to perform again in hand hygiene so that we could remove any remaining microorganisms and prevent infection.